when you look at yourself in the camera, you're like disgusted with what you see because you've been seeing.
There's a lot of information on the internet, and you might say,
confusing.
"Oh, it's so confusing."
Yeah, and it might not be applying to you at all, and you start applying things to yourself that do not. Welcome back to Inside Out. I have a new guest with us today. This is Natalie Plana. She's a plastic surgeon, and I wrote a little intro for you. Today's guest is Dr. Natalie Plana, a facial, plastic, and reconstructive surgeon trained at NYU School of Medicine, where she was recognized for excellence in plastic surgery before completing her residency at the University of Pennsylvania and Children's Hospital of Philadelphia, one of the most competitive training programs in the country. Her work spans two very different worlds. On one side, she does reconstructive surgery for children born with cleft palate and patients recovering from traumatic facial injuries, work that often unfolds over years, not a single operation. On the other, she performs elective cosmetic procedures for people who simply want to feel more like themselves. She's published over 50 peer-reviewed papers, and today we're getting into where medicine, art, identity, and self-image all collide. If you've ever wondered where the line is between healing and enhancing, or what a surgeon who works on faces for a living actually thinks about the way we talk about beauty, this is that conversation. Natalie Plana, welcome to Inside Out.
Thank you so much. It's a real honor to be here, and I'm really excited for a great conversation. I have to say that's actually one of my favorite intros that I've had, because so many intros in medicine are, where did you train, or what have you done, and what school did you go to? But you've really captured what I want to be able to do in my career. And when, I hope I have a very long career, but when I finish and I look back, I want to look back and know that I've achieved all the things that you just described. So you really encompass it really nicely. Thank you.
I'm glad you feel that way. Thank you. So a little bit about how we know each other. We have a friend in common, which is Steph Perez, and she was like, hey, I have a friend. She's a plastic surgeon, and I think she would be amazing on the pod. And this was like a few months ago. And then we tried, you're in New York, I'm in Miami. We tried to connect, and it's summer, and like we were kind of like missing each other. And to be completely honest, plastic surgeon wasn't on my radar for the podcast right now. Like, something maybe eventually, but I always want to find a connection and a theme and something that like I'm trying to share with my viewers, whether it's knowledge or to connect it to what like my real beliefs are. And we finally, she told me, you guys went to the same elementary school. I remember your sister, like you guys have like the same face. And your sister was a year younger than me. You're two grades younger than me. And so I knew the name, the face, and finally we spoke on the phone last week. And I think it was like such a great conversation because you were talking to me about all of like everything you do and like the scientific part of it and like everything you're building, which you're clearly very, very passionate about. And really, I think you're very smart. Like that's definitely like very apparent. You're very smart. But then I told you like, okay, I think that's great. And I have a lot of thoughts and opinions on beauty on the outside, beauty on the inside, how you feel on the inside first before on the outside. Like, and I'm not against making any kind of changes. There just needs to be, for me, a process before that. So knowing the options that are available, that's something that I really wanted to have you on here for, like to share. But then also when I told you how I felt, you like connected all of that super clearly. You were like, absolutely. And we had a conversation. It just felt so aligned and you got what my message was and I got what your message was. And that's why I was like, yes, let's do it. Like, you were in town this week and it was just like perfect. So thank you for being here.
Of where I am currently, I'm based and my practice is in New York. But I'm slowly starting to make my way back to Miami. Like you mentioned, I grew up here. We have a lot of similarities in our background and we went to very similar schools. We had a lot of good similar friends in common. And so that's what I love about Miami. That there is this incest that exists here. And I say that with a positivity behind it because it's the community that to me is home. And I think that you and I sort of represent what sort of the new Miami is sort of looking like. Because it's a reflection of the old Miami, right? There's a lot of new faces in town and a lot of new people, which is cool. But we sort of represent what was here before and what will continue to exist in Miami over the next several years. So I'm really excited about that. But when it comes to plastic surgery, I think there is a big misconception of plastic surgery being the solution to somebody's problems. And perhaps being the solution to someone who is now aging or unhappy with their appearance or unhappy with themselves. And I completely agree with you that plastic surgery isn't a solution. It's an extension of work that should already be in place and what should be done already. As a plastic surgeon, my role, my way of servicing people is to ask them, like, who do you see yourself as? What is your identity? Who do you want to present yourself to the world as? And why, in what ways do you feel like your appearance is not sort of lining up with that? And so if someone's looking to have plastic surgery to, move ahead in their work or impress the people in their community or get a better job or, find a husband or whatever that is, I'm not the plastic surgeon for them. Right? I don't think that anyone should be. That's not the motivation of why you should pursue plastic surgery. What I think that someone who's interested in plastic surgery should be looking for is to say, I really love so many aspects of myself, and they can come up with an entire list of all the things they're happy about and they're proud of in themselves. And they say, well, but when I look in the mirror, there's this one little thing. And whether that's something that you were born with or something that developed over time, that is when you can really think and say, okay, I as a plastic surgeon am excited to help you, and I'm excited to give you a result that you're going to be excited about in the future. Because if you're getting plastic surgery for someone else, it's really, you're never going to be happy.
You seem to me like if a patient comes to you and wants to have a conversation, like you spend time with them, you have those conversations, but do you wait for the person to bring it up and to say how they feel? Or do you ask those questions to see, like, how do you handle that?
That's a great point. So I like to get to know someone first. Just who are you in the world? That's kind of an opening question that I like. Just to get a sense of what are they excited about? What are the things that they look forward to? And that starts to give me a little bit of a sense of sort of what their personality is, ultimately what their goals will be. And then slowly, without asking an overt question, they will reveal what it is that they're looking. So I'll actually give you a good example. During COVID, at the peak of COVID, everyone turned to Zoom, they turned to the computers. Plastic surgery boomed, right? Now people didn't have, they had resources because they weren't traveling, they weren't throwing big parties, they had a little bit of money, they were looking at themselves in the mirror and Zoom all the time, and they thought, I really want to get plastic surgery.
And they had time to heal and recover.
And also, they had, exactly, perfect time for recovery. So at the time, I was learning from a great plastic surgeon in Philadelphia. His name's Lou Bucky. And he taught me, just look at the patient. We were doing telemedicine visits. And he would say, just look at the patient and just have them talk. And they're going to reveal in their gesturing what they're unhappy about. And sometimes they won't even notice it. They won't even know that that's what they don't like. So on a Zoom, suddenly we notice women holding up their neck. A lot of gentlemen, would sort of rest their hand up on their eyes, and subconsciously they're lifting up their eyebrow because they're starting to feel like there's hooding around their eyes. And they don't even know it. So when they come for the consultation, they would say, I just want to look younger. But they can't pinpoint what it is. But when you have the right eye and you can see what it is that they're presenting on a Zoom, then you can pick up, okay, they're a little bit subconscious about this. Let's bring that up and see what it can be. And so the same way they're having those gestures in front of a consultation with a plastic surgeon, they're having those gestures in a Zoom when they're presenting in front of a board, when they're speaking in front of their boss and gearing up for the promotion that they know they deserve. And so they're not present in the conversation that they're having. They're subconsciously already thinking about these little things. So that's when plastic surgery can really thrive, when it eliminates that even in the back of their mind. They might not be front of mind on it, but it'll eliminate that possibility of, I'm a little bit subconscious about this or that, and so I'm going to hold my neck out of the way. And that way they're actually going to be present and ready to have the conversation that they should be having. So it's not necessarily about changing your appearance, about changing your identity. It's really about giving yourself the best opportunity to present yourself in whatever it is that you're doing in life.
I agree with that 1,000%. I think in life, we have gotten so used to like things being hard, like that's the right way. And sometimes we struggle because we don't know the way out. And I think that there's always a path to getting out of a situation that you're not happy in, when you do research, when you get knowledge in anything that it is. So for example, when it comes to appearance, and maybe you're not happy with something because you were born that way or because it developed, like you said, and you just don't know how to change that. And you struggle so much because you're like, one, you have this messaging where like natural is always best. And, you know, I should just learn to love that. Or it's really expensive and I can't afford it. So like, that's not even an option for me. Or, you know, like there's just so many things that then you're like, I'm not happy, but there's no way for me to change that for all of these other reasons. And I think there's always a way. That's one of the reasons I wanted to have you on, was like removing that guilt and that shame from what plastic surgery is that some people feel, removing like it's just not attainable for me. There's always a path to get to where you want in a healthy way. Sometimes people feel really great on the inside and then they're looking in the mirror and they just can't feel that way because of what they're looking at. So like maybe that's the missing piece. I am super about doing the work on the inside first. And I believe that 100%. And sometimes it takes like doing both at the same time too, to like really get to where you want to be. I'll give you an example. Like I just got a new car 2 days ago. And to me, I'm like, material things aren't important. Like that is so whatever, like blah, 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 blah. But I did like all of this research for the first time in a long time. I went to a bunch of dealerships. I test drove cars. I was looking at every time I would drive, I was looking at in the street at like which cars I like, what's the aesthetic, what's the back, the lights, the colors, like trying to figure out. And then it was a little more expensive maybe than I would have wanted to. But like at the same time, I drive my car every single day a lot. I take my kids to school. They're really far. Like I'm in my car a lot. And I had a car that was a great car for most people, but it didn't represent me. Like I didn't love it. And this time I was like, I'm going to find something that I really love because I'm going to go in that car and the way that it's going to make me feel every day is so important. So yeah, maybe it's part of the outside world, not necessarily the inside, but like sometimes the two of them together is what really makes that difference. And I really believe that these next, few years that I'm in this car, like it's going to change my daily, how I feel in the daily thing. And it's going to affect other things that I do just because it gives me that impact. Because I'm happy. I feel good. So
you can see it the way you're talking about it. Like, I can see how pumped you are to end this podcast and get in that car and go wherever you're going to go.
Yes.
Right. And I think the difference is you bought the car, you did the research so you knew what it was. Mm-hmm. You allotted your budget and you say, okay, I can accommodate for this.
Yes.
But more than anything, it makes you feel a certain way. And it's not about, I bought this car to show it off to wherever I'm going. Mm-hmm. You don't care who is looking at you in the car.
Exactly.
You convey that so well. And what the difference is, whenever you arrive where it is that you're going, now you're going to present yourself different.
It's about me. It's about how, when I get out of the car, the difference it's making in who I am, not what people are like, what people are thinking about the car.
Yeah, and even the way that you're going to show up for your kids when you pick them up at school, the other parents when you're there, wherever it is that you're at, it's not about the actual vehicle, but what it does for you.
Yeah. And I think obviously we're talking, like the car is like a metaphor in a way, because it's like the same as us, how we look on the outside sometimes. Like there's value in that, and it's important to look however it is you want to look and feel, and it's going to make you feel a different kind of way inside. I want to talk a little bit about like back in the day when you would hear plastic surgery, or at least for me, it was very much like changing the person completely. Like they would look like a different person. Whereas nowadays, I think people are looking for a lot more natural enhancements, or the facial balancing, the body balancing. Like before, I think it was very like, if you want to change something, it's like, that's where like the guilt and shame came. Like, oh, you don't love who you are. And like, you're just trying to change something. And now it's like, I love who I am, but I want a little bit more of a jawline, a little bit more of a chin, a little bit more. So it's like a lot of, and it's very, I don't know if you want to say like scientific or just like very visual, like, this is going to look a little bit better. And
no, I totally hear what you're saying. So when I was younger, even when I was going into medical school, I was turned off from plastic surgery for the same reasons you described. My sort of sense of it was very sort of 1980s, 1990s, dramatic aesthetics, very slender bodies with
very
like
fake.
large.
Everything
very
was
fake.
like fake looking.
Society has evolved as a whole into enhancing your natural foundation. And thankfully, I think the aesthetics that our society is now leaning into is much more natural, is much more, it sort of leans into like, what is your native ethnicity? And let's accentuate that.
Yes.
What is your sort of natural chapter in life?
Yeah.
Because it's not natural to look 25 when you're 75, right? And so I think that there has been a really good evolution to that I'm happy actually predated my entry into plastic surgery.
Yeah, and I love what you said. I think it's like not changing what you know.
No, because then you start falling into that spell of all of these patients sort of looking the same.
Right.
You see all of these women who have the same look after a certain age.
Yeah.
And so that's not unique. That's not fun. That's not you.
Yeah.
Right. So I sort of have this idea that like the best plastic surgery result can be the one that a patient sees when they close their eyes and they think about themselves at their best. Like, okay, close your eyes and how do you see yourself?
Yeah.
And you'd be surprised to see that, and this happens to me too. You close your eyes and you look yourself in the mirror and you're like, okay, like 85% of it is there, but there's just 15% that didn't look like that when I closed my eyes. And I think that starts to come out a little bit more as we get older, as we start to age. That certainly shows up in ways when people need a little bit more of a reconstructive type of surgery. Like you mentioned, a lot of what I do is after some sort of trauma or children who are born with congenital differences. So that's when it comes a little bit more into play. But when you close your eyes and you see yourself a certain way and you're like, you know what, I just really don't like this bump on my nose. That you can get rid of that bump and get a really good rhinoplasty and probably help your breathing too. So there's a functional side of it without changing who you are or how you look.
Yeah.
Because your face is your identity. And it's like the one thing that you have from birth to the end of your life that will evolve and mature, but it's not going to change.
Yeah.
Everything else about you changes. Your height, your weight, the amount of hair that you have, everything will change, but your face will be the same. Just with time, it'll mature. And I actually think maturity is sexy. Maturity can be very handsome.
Yeah.
It can be very sensual in women as well, because maturity communicates wisdom, it communicates experience, it communicates an ability to understand the world and navigate it in a certain way. And I think that your face should really reflect where you are in your life, what chapter you're living, what season you're going through. And I think back to your earlier point, that natural evolution of the aesthetics has been phenomenal. I'm really happy that I'm practicing plastic surgery at a time that I am, because that's what's existing. But I guess I'll ask you, because I have seen most of that coming on in the New York side. New York sort of has been a little bit earlier to embrace something more natural, something more sort of free-flowing. What do you think the Miami, where does Miami fit in that? Because there can be two sides of it.
I don't know. I don't even know how to answer that, because Miami is very sexy and very, everybody that comes here, they're like, everyone is beautiful and everyone is like, that's part of Miami. Like, you want to look really good. It's very important. I think Miami has a lot of people looking the same, whether it's the body type or the face. A lot of filler here, the big butts, like the big boobs, And I've seen a lot of even like artists taking stuff out and saying like, oh, now they want to change it. But it's always kind of going with the fad and like what's cool right now. And I think that's a really dangerous thing to follow. So like I always say, look inside. What do you want to look like? What do you want to feel like? What is beautiful to you? We shouldn't all be chasing the same exact thing. That's what I think. Yeah.
No, I hear your point completely. I've had patients who've come to me and said, if I'm going to pay $3,000 for filler to my face, I want to look like I've paid $3,000 to filler to my face. And if that is what is a reflection of who they want to be and how they want to present in the world, all power to you, right? I am nobody to say no to that. Now, that doesn't align with my aesthetic so much.
Yeah.
And so in that situation, I can offer patients, some filler and in a way that I think is reflective of my work and the way that I think of myself as an artist. And I can do my best to try to, help them in a way that they're looking for. But that's not how I want to treat patients.
Right.
It's not about a financial cost. I really sort of go back to that, like, close your eyes and see how you want to look at yourself. Right. And if you close your eyes and you look at the model that you saw in the magazine or that person with the filter on Instagram, then I don't think that plastic surgery is your answer.
Yeah. Brought up something that I wanted to talk about, which is filters. And how do you think that has affected people? I am very anti-filter. I don't put filters on anything because I think it causes so much more harm than like whatever benefit it can possibly add. The only filter I ever use is like Paris. So like if I put a story, like I'll put it on Paris, which is like a little tiny bit smoother. That's it. But like the actual filters where you're changing a little bit of the shape of your face or adding makeup, or I just think then when you look at yourself in the mirror or when you look at yourself in the camera, you're like disgusted with what you see because you've been seeing this perfect version that isn't real.
Yeah, filters are tough. There are good things and there are bad things, right? So if we're looking at the good things, filters are like a great example of how technology is advancing and it's now being held at your fingertips. And so being able to manipulate images is cool, it's fun, it's techie. And it's having people take a different perspective on their appearance. So that's not necessarily a bad thing, right? And in my opinion, because you can, without being egregious, apply a filter and be like, oh my God, I actually really like this angle of me, or I really like that thing about me, or, I didn't really notice, but when I fade out this little mole, now I can really, my smile comes out in a nicer way. So I think to a certain level, there is positive value to it. I think that the problem is introduced when the filter is now used to solve something that you don't like or to replace the face that you don't know to be yours. And then exactly to your point, if a filter is letting you sort of create this online persona on social media that isn't you, and it causes you to come home and then look at yourself in the mirror and be like, oh, this isn't me, I'm disgusted by this, that is awful. Yeah. But that signals more a need for the inner work that you so nicely message in your podcast, and so much more that has to come from the inside. Yeah. Plastic surgery is not the solution there. So we use, like in plastic surgery, we're using a lot of simulation, for example, now. So we have the technology to be able to upload an image of a patient or even like a CT scan of a patient, and we can start manipulating things, and I can actually surgically plan an entire operation.
That's so crazy.
It's amazing.
Wow.
It's amazing. Yeah. I can do that in advance. It's mostly for the bony stuff. So when you're talking about, I want a more augmented chin or a better jawline, or some patients who have trauma and they have fractures all over their face, and we're trying to now start putting those broken pieces of bone together. We can do all of that on the computer, and then I can even present to the patient, this is a prediction of what this might be able to look like. And so the technology is helpful there because now a patient has input into, okay, I like this, I don't like that, this is something that's realistic.
And what happens after if they don't really look like that? Does that ever happen? And then they're not happy because they're like...
Yeah, that certainly happens. But that's my responsibility. To have an honest conversation with the patient, say, look, I'm going to get this as close as I possibly can.
Expectations can be,
Setting expectations is absolutely key. And then to your earlier point, the patient who has false expectations because they're used to what they're seeing on the filter, not going to work.
Right, they're not going to be happy.
It's not a good fit. They're not going to be happy. But the patient who's actually using the simulation as a tool, as a prediction, but not as an absolute, that's the right patient who's going to benefit from it.
What would you say most of the patients you see, like what age range are they?
Yeah, that's a good question. So I am lucky that in plastic surgery, we treat patients from birth all the way to 92. So it's very cool. And like you had mentioned to start, I had specialized in facial reconstruction and facial aesthetics. So most of the reconstructive side actually is centered around kids who are born with a facial difference, like a cleft lip or cleft palate. And so those kids, they get, I don't know, 10, 11, maybe 12 surgeries from when they're 3 months old up until they stop growing and they're
insurance
teenagers.
cover that?
Yeah, insurance covers it. It's a huge need, actually. Many of these patients, wouldn't be able to have these kinds of surgeries without insurance coverage. So it's important and very valuable. And so I love treating the kids, especially when you get to see them age and watch them grow up. It's remarkable and it's so rewarding. You see,
and they're probably so grateful and so happy and thankful, like.
They are. Yeah. And these kids are so resilient. Like, they are stronger than any of us combined. Yeah. They have this resilience. They're so witty. They're like thinking 2, 3, 4, 5 steps ahead of you. And so watching them go through all of that is a lot of fun. Watching the parents, because you meet some of these parents even before the baby's born, when they're diagnosed with a cleft lip in utero. So you meet these new parents who are excited, they're pregnant, and they just get this news, and it's devastating for them. So then you can have this conversation with them, and then their baby is born. You can do that first surgery to correct their lip. You can do the second surgery to correct their palate so they can eat better, they can breathe better. Over time, they can speak better. And then over the course of, a decade or so, it's fun to watch these kids grow up. Wow. And these kids are really mature.
Okay, so now the aesthetic, cosmetic patients, what age are they?
Oh, like I said, you can be 92.
Okay. So what are you doing more for the 50s, 60s, 70s? Is that more facelifts, or what do you see very common in older patients? Facelifts,
neck lifts. But now that natural aesthetic is sort of coming into play, and on the stage we're seeing sort of a combined comprehensive facelift. So it's no longer this. Now patients are coming in and they're sort of looking at the entire face. So we're looking at brow lifts, upper lid blepharoplasty, lower lid blepharoplasty. That's going to take out some of that sort of early fat herniation under the eyes and get rid of some of those lines as well. Facelift, neck lift, that sort of becomes like the comprehensive procedure. And you said 50, 60, 70. We're actually starting to see patients who are coming in even younger, in their late 40s, who are looking for a facelift. So
do you agree with that strategy? It's better to do it earlier, or is it better to wait till you need it?
It depends on the patient.
Okay.
And so not every 45-year-old is made the same.
Because like Anne Hathaway, did you see her work?
Yeah, she looks great.
Yeah.
She looks amazing.
But then Kris Jenner also looks amazing. She waited. We don't know what Anne Hathaway is going to look like or is she going to have to do it again? Like how?
Yeah. So, the way I like to think about it is it's not your chronological age, it's more your biological age. Okay. So some folks just age earlier. Some folks tend to age a little bit later. A lot of that has to do with your race and ethnicity sometimes. Sometimes it's just genetics in yourself.
Do the Latins, we age earlier?
A little bit more gracefully, yeah.
Okay, gracefully, so better.
Yeah.
Okay, good.
For the most part.
Okay.
Right? So that's working in our favor.
Okay.
But I do think that a nice early facelift, if you're starting to see early signs, I'm a big advocate of that because you can get a really good lift. You can enjoy the results earlier, so you're not sort of in this in-between stage of, I kind of don't like it, but I'm waiting until I get older. This goes a little bit more to like, I feel a certain way, I kind of want to look a certain way.
Yes.
If you're 47 and you want to you want to look a little bit more like the way you look when you close your eyes, go for it. You won't get as dramatic of a pull because you don't need that much of a dramatic of a pull.
Right.
But now, and this is selfish of me as a surgeon, because now I'm dealing with healthier tissue. I'm dealing with younger tissue.
Right.
I'm dealing with more elastic tissue.
It's going to be a better job all around.
It's going to be a better job.
And it's going to be a better experience for the patient because they're going to recover quickly. And
yes.
Yeah.
Yep. They're going to recover really nicely. They're going to enjoy the results immediately, and they're going to enjoy the results for longer.
And then if they need it again in 10, 15, 20 years, they can do it again, and there's probably going to be like way better technology then. So it'll be
maybe, yeah. Hopefully, at the rate that we're going with advances for sure. But even if the technology were to stay exactly the same, the second lift at that later age will be later than what they would have had if they had waited. So I'll give you some numbers. Instead of waiting until you're 57 to do your facelift, let's say you do it when you're 47, your next one won't probably be until you're, 62, 63. So you're delaying that a little bit more.
Okay.
You're enjoying that result for longer. And then the second lift will be a little bit easier as well.
Okay.
So
Less work to do.
Less work to do. And you're not sort of hyped up and sort of caught up in your mind. You've been through it already. You kind of know what it's like. It'll be just a smoother process overall.
Okay.
So I do think I am hopping on board with this new sort of movement towards earlier facelifts. I think it could be helpful. And then I also think that some facelifts aren't necessarily for aging purposes, right? Now we're seeing the benefits of a facelift for facial structuring or facial contouring. So I actually learned this in the last practice that I was at, but even in a really young patient, you can start seeing some sort of squaring around the soft tissue. Their jawline was beautiful and nice and clean and sharp and had a good angle to it, but the soft tissue was sort of lagging. It wasn't because the patient was aged, it wasn't because they were older, but suddenly with the facelift, now it gave them much more of a heart shape, and it took away some of that squaring that they had. And so probably, if they had waited another 10 years to get their facelift, they would have gotten that result, but why not do it now when you can enjoy it?
Yeah. So what are some really common, maybe like small changes that you wouldn't think that really make a huge impact in certain people? Maybe I don't know. I feel like this area has, before it wasn't, people didn't realize what a huge impact that like having a jaw or a chin makes.
Yeah. Oh my God, you like hit the nail right on the head, because you're absolutely right. I think for so long we were so focused on, the cheeks or the lines and your smile lines or maybe the jowls, but now the jawline has gotten so much attention.
Yeah.
And if you actually look at like a Vogue magazine, let's say, and you look at models from all over the world, from every different country, every different continent, all sorts of different cultures, the one thing that is beautiful across all of them is the jawline.
Yeah.
Like a nice, crisp, clean jawline makes a world of a difference.
And especially in men too. Like
for sure.
For men, that's like the very masculine, sexy, like having, and a lot of people, maybe they don't have a chin or they don't have a jaw, and it's like, that will make a huge difference. Would you say surgery or fillers is better?
In my opinion, I'm a surgeon.
Right.
I like surgery. But I do think that surgery is the better option.
Why?
And this is what I like. I do like filler as a stepping stone.
Okay. To test it out, kind
of.
Test
it out. Filler once, not multiple stages, because then it starts disrupting the tissue and some of the filler stays. It doesn't go away.
Yeah.
So now that you're kind of dealing with something that's a little bit tougher. But one round of filler and you're like, you know what? I think I like my chin a little bit longer, a little bit more projected. Let's see with filler. It's sort of like a nice gateway into surgery. And if you like it, I don't want to discourage, others who offer filler and stuff and things like that. But I do think if you like it, surgery is a fantastic option for you.
Because it's more permanent.
It's permanent. And it's just safer. It's not so disruptive. So I like two options for that jawline augmentation. The first is implants. Facial implants got this really bad rap, I think, in the 90s, early 2000s, because we were using a lot of silicone, and silicone wasn't the best material for it. Now, I like to use a material called PEEK. It's a material that is actually used in like building NASA aircrafts. But what I like about it is it's biocompatible, meaning it interacts with the body very well. The body doesn't reject it, and it behaves a lot like bone. So what we can do with PEEK is that we can actually get a CT scan of the patient, and we can draw out exactly how the implant will look on that individual patient and make it custom exactly to them. It's not something you take off the shelf that's like a small, medium, large sort of sizing. It's incredibly precise and specific. Okay, we need a little bit more length. There's an asymmetry, so we need to make the implant asymmetric to now get the face to sort of fall in line and centered. So I really love implants in the chin and in the angles of the mandible, because that's what's going to give you sort of like a nice, really crisp sort of look there. I do like implants for the same material for the cheeks. You just have to be tasteful and like very
not overdo it.
You can't overdo it. That's The cheeks is a really easy place to overdo
Okay,
it.
so implants you can do here and you can do here. Where else would you potentially do an implant?
You know, for men, I think implants are really great for men. For women, for sure as well. But I think they really shine
big
in
impact,
the male demographic. And so some guys want like a little bit more projection up in the brow, so they can get like a little bit more of that hunter appearance, like nice, strong masculinity.
Like
I really like that. It's not as commonly used. Again, an area you have to be really soft and subtle with, because you can sort of make
Overdo
them
it
look
really quickly.
Yeah, they can look like a Marvel character.
Yeah.
But if you're tasteful about it, and that's what's cool about the 3D simulation, you can do it in advance on the computer.
That's
on
insane.
Just their skull. It's awesome. And you can, if you don't like it, you can have 20 different iterations without ever cutting somebody open, right? Because this is real surgery.
And all of these implants you can do scarless.
Most of them, yeah. You can, everything that in the chin, in the angles, and in the cheeks, you can make these, you can access it inside the mouth. Okay. So there's no scars on the outside. So that's a really good point. Thank you for bringing that up. That's sort of something that I've been well trained to do. Okay. A lot of my training has been about keeping the scars outside of the way.
Okay.
The other sort of option, if you're thinking about jawline enhancement or the chin, is jaw surgery. And so jaw surgery is something that we used to disregard as a big procedure that had this terrible recovery for people who didn't have the right bite. So if someone had like an overbite or an underbite, or their teeth didn't come together, they would need jaw surgery. But we have now, with a lot of the simulation and the digital advancements that we've been talking about, we can now perform jaw surgery in such a way that minimizes the recovery dramatically to what it used to be, and the impact that it can make on someone's jawline or on this lower third of their face is pretty profound. And sort of to your point earlier about, you know, if you're thinking about this, or if you're like, you know, I had no idea that was even possible, let me take a look. You know, I'm happy to always have a conversation with anyone, even if they're just sort of curious about these things. Talk to surgeons, go online, look into it.
Okay, so those are options for changing face structure, bone structure, adding, and then the facelift is more like when the skin is sagging to kind of bring it back.
Exactly.
Which is similar to what, like anything where there's either extra skin, so like the upper bleph surgery would be to cut that out, or here, what is this?
A lower bleph.
Also?
Yep.
So it's also cutting when you have too much extra here. Okay, so what like are those different types of categories when you're looking at your face and you're like, okay, there's something I don't like and I don't know what it is. How do you start to figure out, like, maybe I need to add something, maybe I need to remove something? How do you know where to go with that?
Yeah, you know, talk to a plastic surgeon and talk to someone who you trust, whose aesthetic you actually vibe with. Because sometimes there's a lot of information on the internet, and you might say,
confusing.
Oh, it's so confusing.
Yeah, and it might not be applying to you at all, and you start applying things to yourself that do not.
Right.
Yeah.
And so like you may not realize it, but like, you know, you're scrolling through Instagram and you see, you know, this like lower lid bleph, and you're like, oh wow, that's a great result. Oh, I think I have that. And you look and you're like, that's actually not the right procedure for you. But mentally you start going down that route, and you may sort of get lost in it.
Which is the main reason why I wanted to have you on. I think people are so confused and lost sometimes, where they're like, I don't like something, and they don't know what it is. What do I do? Like, what is going to fix it? And even, I think it's important to go to multiple plastic surgeons, and it's a lot of work. And sometimes people are like, I don't feel like doing that. And they just go to one, and then and maybe they end up not happy. But like going to different ones, someone you trust definitely, or get recommendations from friends, and then go to those consultations, hear what they have to say, compare and contrast. Which one did you feel understood your goals?
And, you know, I know that it's a lot of work, but in the same way you did that research for your car, it's a worthwhile investment. And you can do that research sort of ahead of time. Meaning you find maybe 2 plastic surgeons who are in your area, or 1 plastic surgeon who you know has like a good national reputation. And you start looking at their content, because plastic surgeons are now being very educational online. In many ways it's great because it's good education. Sometimes it's not so good because I don't necessarily agree with all the things that they're presenting. But when you pick someone, start to look at their content, start to look at the way that they communicate what it is that they're doing, how they look at things, what they actually find to be a good aesthetic. You look at their before and after photos, and you start to get a sense of, okay, this is someone who I think will understand what I'm looking for. And then you go see them, and you have an in-person conversation, and they're gonna pick up on things about you, and you're gonna pick up on things about them, and it's like dating.
Yeah.
And you will know intuitively pretty quickly
Yeah.
if this is someone that you want to move forward with, or if this is someone that you just need to sort of pass the buck on.
Yeah.
So it's a lot of work, but I don't want people to become discouraged, because I do think that very quickly you'll start to understand, okay, this is the right path. I'm
Yeah.
really excited, like
Yeah.
you did with your car. I
Yeah.
really like this car.
Yeah.
You'll get the same sense and vibe from your surgeon.
I agree. I have thoughts and opinions, and I want to hear your thoughts and opinions. What do you think about people sharing what they've done or keeping it to private? What are your thoughts on that?
Oh, okay, cool. So do you want to go first, or should I go first?
You tell me.
Okay. Me personally, I'm an incredibly private person. And so people are always telling me to do my nose because I have this bump. And I'm like, I don't know if I want to. Right? Like, I've been encouraged, like, oh, like, well, you're a plastic surgeon. Like, maybe you should do your nose. And I'm like, I don't know. I kind of like my nose. I kind of like some certain things about it. Maybe in a couple of years I'll change it. I don't know. But right now, I'm kind of cool with it.
Good for you.
But if I were to do my nose, I'm not someone who is going to lie about it and say that I didn't. If someone asks me, did you do your nose? Yeah. And I'm really happy, and I love this surgeon, and this is why I picked them. But I'm not going to come up to other people and say, well, you should do your nose because I did mine.
Yeah.
I really don't buy into that philosophy at all.
Okay, fair.
Okay, what's your take?
Okay, so I am also a very private person. I like to keep things to myself. I think beauty and aesthetics, I think the mystery behind it is part of it. So like on Instagram, it's very popular now to like, I'm not a gatekeeper, and I'm going to share what I injected here, and I did this and this and this and this. And if you don't, then you're not a girl's girl. Like, and I do not agree with that messaging at all, because if that's what you want to do and you want to share that, go ahead. Like, that's kind of your thing, your personal brand, sharing that stuff, great. I don't think anybody should ask anybody, did you do this? What have you done? Like, that I think is a very disrespectful question to begin with. And if somebody asks you, I think, and you want to lie, you are perfectly in your right to lie, because they shouldn't be asking you that in the first place. And of course you could say it's none of your business, but if you want to say no, great. The one thing I am very against is somebody promoting I'm all natural and I've never done anything and when that's not true. So like, that is wrong. Asking someone is also wrong. And I think we're all aware that there's things out there to enhance and to like make a little bit better and all of that stuff. So like, somebody wants to share it, great. If somebody doesn't, that's okay too. Like, you don't have to.
Yeah.
And it's something that like I've thought more and more about, because I see this side and then I see that side, and I'm like, how do I feel about this? And like, I came to that conclusion of all of those thoughts and opinions.
I completely agree with you. I think you're totally right. But I think ultimately it comes down to, how do you feel most comfortable for yourself? Because all of the examples that you described are for other people, right? I want to lie to other people so they can think that I'm all natural. Or what do you think about yourself?
Right.
Or I want to promote this so everyone can know all the things I did, so they can,
or so I can seem like I'm such a girl's girl, or like,
right.
And yeah.
And perhaps you are,
yeah.
Right? And perhaps that is honest and true. And if it's who you are,
great.
Go for it.
Wonderful.
Right?
Yes.
But because that's a reflection of your inside,
yes.
Not because you're trying to get people to like you, and perhaps present a falsehood that you are transparent when in fact you're not.
Yeah.
Right? So I completely agree with a lot of your points. From the surgeon's perspective, it's every patient's individual decision, their individual right. I would never approach a patient in a public setting suggesting that I had performed anything, or nor would I ever announce to another patient that I had done something.
This person did this,
And it's common. A lot of patients will come in and say, "Oh, I'm friends with so and so, and she told me about this and this procedure that I had done, and I can't."
You don't even
confirm
it
or deny it, right?
Good for you. Yeah.
I sort of just redirect the conversation to them. Because I think that's important. I think
Yeah.
privacy it's not my right to violate that for anybody.
Can you share a little bit about, like, you're currently in New York, you're coming back down to Miami. What does that look like as far as, if somebody wants to work with you, how would they go about that?
Sure. So I'm in a really cool sort of phase of transition now. I've been in New York 18 years.
Wow.
Through schooling and training, and I had a short stint in Philadelphia. But I am establishing my own practice. I'm going out on my own, which I'm incredibly excited about.
Wow.
And so maintaining my practice in New York, but once a month I'm going to be coming down to Miami. So I'm in a fun phase down here where I'm starting to look for office space. I'm developing a website, so stay tuned because my website is in the works and it's going to be coming up in a little bit. But it's fun sort of spanning between New York and Miami.
Sure.
I think it's a goal of a lot of surgeons.
Yeah.
It's a goal of a lot of aesthetic practitioners that they aim for sort of later. And in my mind, I don't know, if you're going to do something later, why not just do it now?
Yeah.
And I'm in a cool phase where I'm in a building phase. So having a presence on both is great.
Yeah.
Spanning, and sectioning out my time is going to be require a little bit more organizational skill. But down here in Miami, I'll be here on a monthly basis, so I'll have access to my patients. Of course, patients will be cared for well after surgery. I'm not going to let them go. But it'll just be a little bit more of a book out time before you may be able to see me or schedule an appointment or schedule surgery. But we'll make sure we can make that happen.
Amazing. I'm huge on personal development. Is that important to you?
Yeah. Yeah. No, I mean, I sort of have this mindset that if you're not growing, you're stagnant. And if you're stagnant, you're not living. Mm-hmm. Right? Like every organism around us, like these plants, they are in constant turnover. Every cell in our body is in constant turnover. So if you're not looking for an opportunity to grow personally, professionally, spiritually, economically, in any regard, then, that's not a life that I want to live. So personal development it's so interesting because the same way we were talking about how like facial aging is more of an evolution of sort of the way that your face takes form. Mm-hmm. So that is true about your personality. Yeah. That's true about how you look at yourself. That's true about your relationships with other people, family, friends, intimate relationships. So like life is so complex that if you just sort of take it at face value, like you're really not experiencing things for what they are, what they can offer you. Yeah. And I think like there's a real opportunity cost to not developing every single day. Like you are missing out on a lot.
Yeah, it's beautiful. And I agree completely. What do you do to invest in yourself personally, besides like the career and all of that?
At the moment, it's very physical. So I was a dancer when I was younger, and I let go of dance, and then I went to medical school, and I kind of just like dropped all of the physical stuff. Like I stopped going to the gym in the same way. And like I would still eat healthy and I would have healthy habits, but I kind of let that go. And over the last several years, I've really picked that back up. Mm-hmm. And I had all the great excuses. Oh, I'm in medical school. I'm in residency. I don't have time. Yeah. That's all bogus. Yeah. Because if something is important to you, you will make the time.
Yeah. I think you have to be a little easy on yourself sometimes because there's seasons where something is going to require more of you. Like it happened to me with the podcast. I also stopped going to the gym. I stopped doing a lot of things that I love that fill me and that are important to me and make me who I am and make me happy every day. But there was something new I was doing and I needed to dedicate time and like be graceful with yourself because there's seasons. And then now I'm like, okay, I'm able to incorporate all of those things back and, feel the balance again.
Yeah. Yeah. No, you're absolutely right. There are ebbs and flows. And I'm more appreciative of the physical stuff now because I had let go of it, right?
Yeah.
And don't get me wrong, now I'm in the gym, I'm like, I used to be able to do this with such ease before.
Yeah, but you'll get it back quickly.
But I'm getting it back and I'm building it in a stronger way with good form.
Yes.
So
if someone watching this is sitting at home insecure about something on their face or body, what do you want them to know before they do anything about it?
I definitely want them to know that their face is beautiful in the way that it is. I want them to know that they're no different from anyone else in the world who might look at themselves in the mirror and not be the happiest about a certain area, one or the other. But if it's something that bothers them to the extent that they want to explore options of how that might be able to change, then I would strongly encourage them to talk to professionals, surgeons, plastic surgeons, dermatologists, depends on what the item is. Do a little bit of research. Don't get caught up in sort of the craziness of what's online. Find a good resource that you trust, talk to them, and see if it's something that you want to fix at all. And if you do, what are some of the options for you? And is that a road that you want to go down?
Great. And then this is my final question, which I've actually never asked anyone before, but I feel like you're a good person to ask. What does inside out mean to you?
Oh, that's a great question. I think it is sort of speaking to life and growth. It becomes the foundation of how you can grow in life. Life is about just as much about community, relationships. We would never function as a society without other people, as much as it is who you present yourself to those people as. Mm-hmm. So there's a core root or a seed that is meant to grow, and that you should nourish that with every resource and capacity that you have, so that can evolve or blossom into this beautiful flower that you can now present to society, so that you can engage with the people who are meaningful to you and that you love. And then they're going to have their own seeds inside of them that will blossom into a flower. And then with all of that, it can become like this beautiful garden that we can all sort of function in together without letting go of our individual roots.
I love that. That's beautiful.
Yeah.
Thank you, Natalie. Thank you for coming on. It was wonderful to have you here and to learn from you. And I loved our conversation, so thank you.
I had so much fun. This is a blast.
Me too. Thank you all for watching, and I'll see you next week. Thank you so much for spending this time with me. If something in today's episode resonated with you, I'd love for you to subscribe, leave a review, or share it with someone who needs it too. I'll see you next time. Until then, keep choosing to live from the inside out.